So good morning to all of you, and I'm delighted to be here today. I'm actually delighted to kind of support this day for Ovacare, because I think individual cancer support charities that target specific cancer like ovarian cancer are even more helpful than the generic ones for we try to cover all the cancers. Because I always think that, I know through working in cancer care breast myself, that very often the best support comes from each other. And I suppose that's what just really struck by some of the things Phil said there, and some of the things she said we hear a lot in our service. So I suppose it's just really good to kind of get together, and because the people who have had the very same cancer know exactly what you're talking about, even if lots of people don't really understand it. So I was delighted to kind of agree to give this talk, and I suppose our whole kind of philosophy and our whole structure is about trying to get people to get through the cancer journey, whatever stage they're at. And we see people from the time they're diagnosed, and sometimes even before they're diagnosed, when they're waiting for a result, right through their treatment, right through kind of when the treatment's over, and then maybe if they have a recurrence or whatever happens at the end of their journey. And I suppose a lot of our work is about people, supporting people who are post-treatment, because the hospital services now are structured in such a way that you get a lot of support in the hospital system when you're in it. When you drop out of it, when you're no longer kind of being called back for appointments every week or every month, but when you're, say, once a year or something like that, that's when people really need support. And I suppose one word that Phil said there really, really struck me, and I truly believe it, and it's that cancers can be such a lonely place to be. Because unless you have it, you can only imagine what it's like most things in life. So I think it's very, you know, it's so kind of good to have somewhere to go, I suppose, like our service, where you kind of can meet other people who are going through a similar journey. So today is all about that kind of theme, and about coping, and about what we find helps people, and what are the issues that come up for people when they're going through the cancer journey. And a lot of what I say today applies to both when people are going through treatment, but also when your treatment's over, and when you're kind of living every day with the reality that I had a cancer diagnosis. And I always think that that reality of having had a cancer diagnosis probably takes about a year to hit people. And I don't mean that you don't know you have it, but what I do mean is that living with it is a reality that's very different to thinking about it. So even things like, say, a loss of energy, maybe being less able to do things you were able to do before without even thinking about it. Like I had a woman into me yesterday who has returned to work after ovarian cancer treatment, and her employers expect her to be exactly like she was before she became ill, before she had treatment, and she's just not able to do it. And to have to constantly explain yourself that you're not Dawson, that it really is that you can't actually carry out the same level of work as you did before. Really, people don't seem to get that idea. So it's very difficult, because then you start to feel like, do people believe me? And you start to even feel guilty about it, and then you start to feel like, you know, people are being judgmental. And I always think as human beings, we're very good at being judgmental of each other. Like, we're very good at kind of knowing how other people should behave, maybe not looking at ourselves. Like a lot of people who, you know, who interact with people who have cancer, and particularly when they're post-treatment, kind of forget, don't really know what it's like to be that person. So I suppose I just want to start with this quotation that I had from a client, because, and this was actually about ovarian cancer, because this what she said really struck me, because I think that this is what living with the reality of a cancer diagnosis is actually all about. That you never forget the fact that cancer changes you in some fundamental way emotionally, and that you always have some awareness that it possibly could come back, even if you get a great report from your doctor. You're being asked to live with an uncertainty that's very difficult. And that's a big challenge in cancer from a psychological point of view, is living with uncertainty. The uncertainty that you're never guaranteed it won't come back. And that changes the way people live, and changes the way you are in the world, and the way other people are towards you as well. So I think it's can be very kind of emotionally kind of, you know, a very kind of demanding, challenging time. And for that reason, I think, you know, people need a lot of coping strategies. And I suppose the one good thing about cancer, I think sometimes, is that people learn they're much more resilient than they think they are. They're way better at coping than they think they are. But sometimes the cancer diagnosis, that's kind of the silver lining on the cloud of cancer, that you actually realise, if someone told me I'd go through this, I wouldn't have believed it. And yet here I am standing here today, you know, and I'm still standing upright. Somebody said to me, I said, how are you? I got out of bed this morning, didn't I? So I thought, well, that's okay. So it's, you know, that's often it's down to that level of kind of coping. So I suppose I was just reading that book there that was introduced about it's a fantastic resource, that booklet that's on the tables there. And I suppose one of the things that they talk about in the emotional impact is that it's normal to have lots of different feelings. And I think this is the thing really, that people are kind of bombarded with feelings when they have a cancer diagnosis, and they really kind of think, sometimes people say to us, am I going crazy, like there's so many feelings going on in here? And it's not crazy, it's just trying to adjust to what is a very challenging life situation. I think it's important to remember that people with cancer are normal people going through an abnormal experience. And that's how we see people in our centre, that like it's a big adjustment, and that adjustment can take months or years for some people. And I suppose the whole idea that we were lucky enough to be able to go to the International Psycho-Oncology Conference in Lisbon this year, and so one of the things that really struck me about that conference was that now in a lot of cancer services around the world, particularly in places like Canada and in Germany and the UK, they are assessing distress as a sixth vital sign in cancer care. And what that means is that when you are referred with cancer diagnosis and when you're diagnosed, your emotional well-being is assessed as well, to know how are you going to cope with it. I think this is a move towards the holistic treatment of cancer patients, that it's not just a physical illness, that in fact it has a huge emotional impact as well. And I think that's a really, really progressive thing to do, because I think it's also got an economic benefit, because I think if we intervene earlier with people and support them when they're maybe getting into bother about coping, we actually prevent maybe much more expensive services having to be used down the road. So I really think that this idea that we should treat the whole person is really coming to the fore, and that's really important. But I suppose the thing about feelings is that they're unique to all of us. And no two people, I mean, there's a number of you here in the room today with ovarian cancer, and if we were to go around and talk to each of you individually, we would find that you all coped slightly differently, or it affected you slightly differently, because our feelings are completely unique to us. So I think, I see there in that book that one of the pages says, do not compare yourself to other people. I think that's one of the really valuable bits of advice, actually, because when you start comparing yourself to somebody else with a similar story, you can start to criticise yourself and say, I'm not doing as well as I should be. So I suppose common responses that we come across a lot is that like you're being strong for, like patients are being strong for their family and friends, and family and friends are being strong for patients. I was seeing somebody yesterday in the hospital, and she said to me that she's really upset because she feels that she can't talk to her family about what it feels like to be going through what she's gone through. And she said, like, I just feel like I want to mind them. But I mean, when I came outside the door and met her husband, he said to me, like, I'd love to have a conversation with her, but I'm able to say because I don't want to upset her. So here are two people like who really need to talk to each other but don't know how to have the conversation. And I suppose people get support in lots of different ways. So one of the key things about a cancer diagnosis, I think, is that when you're diagnosed with cancer, when you're living with the reality of it, sometimes the support comes from very unexpected sources. Sometimes the people you think would be very best at supporting you, maybe your nearest and dearest, your very best friends, might kind of disappear a bit, mightn't be around, mightn't be available. And people often say to us, like, why is that? And I think often it's because A, they don't know what to say, and they're afraid they say the wrong thing. And B, I suppose they're kind of afraid of kind of, maybe that in some or other, this is a very new part of the relationship and they weren't expecting it. So sometimes the best support comes from unexpected sources, and sometimes it comes from other people with cancer. Or sometimes people's faith is very strong and it helps them to cope. So I suppose this talk is broken into a set of rules, and the first rule that I put up here is do what is right for you and don't compare yourself to other people. So don't be comparing yourself to other people thinking, oh, she's getting on much better than I am, or she's got back to work, or she's able to do that. It doesn't really matter. Actually, what really matters is what's right for you, and knowing your own truth. Because cancer doesn't change your personality. Like, it's going to change your coping, and it's going to change your physical health, and in the short term at least. But it doesn't change your personality. You're still the same person, and it's not all of you. I think I have that slide up later on. So I suppose the very biggest reason people come to our centre in Galway is that they worry about a recurrence of cancer, and that's a big worry. And I think people live with that reality a lot. So especially during the first year, there's a lot of worry about, like, could my cancer come back? And of course, the thing that would fix that for people is that a doctor would say to you, no, it won't come back, and I can guarantee it. And you will never, ever, ever find a surgeon, radiologist or oncologist who will say to you, no, this won't come back. because I don't know. And I think that's what makes it really difficult to cope with. But for some people, their anxiety about returning can become really overwhelming, and then they can't enjoy their life, so they can't live in the present moment. And of course, certain events trigger anxiety, like returning for a scan. I heard Phil saying that some of her levels had gone up. And of course, that's anxiety provoking, because you think what's going on in there, and you can't see it, so we can't judge what's going on. So there are certain times of the year or certain events in the year, that, like when the anniversary of the diagnosis comes up for some people, that can be a tough time. So I suppose what's the second rule for coping? And it's be informed. Like, have knowledge. Knowledge, it really is a very powerful tool. But I just want to do an aside here, which is that it's really important to have knowledge, but actually don't use things like the internet ad nauseum. Like a site like Ovacare is brilliant because you're going to get support there. But sometimes people find stuff on the internet, say like medical reports and research findings and so on, and they can be very scary. Remember, your cancer is unique to you, and what you're reading, you know, may not be about your story. This is your story of cancer. So, like, be informed, but you know, be careful about how you do that. Express your feelings, and don't blame yourself for your cancer. It's not your fault you got this cancer. It's a random event. We don't know how some people get cancer. Sometimes people come in to me and they say, "I knew I'd get something, and I'm not a bit surprised I got this." And other people say, "I was so healthy, I watched my diet, I didn't smoke, I didn't drink, I thought my stress levels were okay. Why did I get it? It's very unfair." And it's completely random. And it is unfair that people get cancer, but we don't know why they get it always. Only very few cancers that we could say have direct specific links to certain things in life. You're allowed to have bad days. This year at our patient conference in October, we're lucky enough to have Dr. Paul Dalton down from St. Vincent's Hospital in Dublin, who runs the psycho-oncology service up there. And so one thing, the theme of his work was, you know, that why being positive is not always good for you. And a lot of our patients were saying, "Oh, I don't like the sound of this talk. Like, is he going to be telling us, that kind of like we should be going around fed up all the time?" And that's exactly what he wasn't saying. Because actually, what that means is you're allowed to have bad days. Is that like just like you ever before you had cancer. Ever before you were diagnosed, you had bad days. There's this terrible burden now called the burden of positivity in cancer, where you're not allowed to have a bad day in case your cancer comes back. And particularly people who aren't well informed, maybe people who read stuff in magazines or see a heading on the paper about, you know, stress causes cancer, get very worried if patients kind of have bad times, say, "God, you're really stressed, like you're going to bring your cancer back." Nothing could be further from the truth. In fact, there is no reliable research to say that stress causes cancer, except one study in the States which has found a link between women who had breast cancer and had a recurrence. And the women who had a recurrence of breast cancer compared to women who didn't have a recurrence, they had higher levels of the stress hormone. That's the only piece of reliable research we have about stress and cancer, as far as I know, up to date. So it's very important to say that stress doesn't cause cancer. We know we shouldn't be stressed because intuitively we know it's not good for our bodies or our health, our physical or our mental health. But you're allowed to have bad days when you have cancer, and you're not doing yourself any harm if you have that. I mean, if your bad day is going into a bad month or a bad fortnight, then you probably need to do something about it. But a couple of bad days together are not going to harm you. Learning relaxation skills, like in our centre we have a relaxation class that happens once a week, which Martina, our oncology nurse who's here with me today, runs for us. And so that's a really good way of coping because it doesn't cost anything. It's very relaxing, and you can do it any time. You can even relax when you're sitting down watching television because you can relax some parts of your body and maybe not all of them. But as well as that, be as active as you can. That's really important. I'm delighted today that both Maeve Craven and James O'Donnell, who run an exercise class and a nutrition class for us in the centre, are both here because actually this is really important. And being active. A lot of research now that says that if you take up and maintain an exercise regime post-cancer treatment, you're less likely to have a recurrence. So there's real evidence to support that, and that's really important. In terms of inflammation of cells and stuff like that, that it reduces that. So we would really encourage people to do things like that. And we have 2 exercise classes a week run by James, who's here today. And yeah, they're really popular, and it's a really good way of kind of meeting other people who are going through a similar experience. And our eldest participant is 83. And our youngest is probably in her 20s. So like, there's no reason why you can't join no matter what age you are. And And I suppose this, from a psychology point of view, is really important, because you have to put your energy into what you can control. Structure, small steps, challenging negative thoughts. We spend so much of our energy every day, not just about cancer, but generally about trying to change stuff that's outside our control. So we say, like, if only I could change that, if only he was a bit different, if only I hadn't done that, if only I win the lotto tonight. Very nice thought, but probably won't happen. So we really have to look at, like, what can I actually change here? What can I structure? What can I influence? And it's all about having a small structure, taking small steps, setting small goals, not having huge goals. There's this statistic which is really interesting, and that I often refer to, which is that they did this research in the States, and they found out that all diets start on a Monday morning, and 95% of them are over on Monday evening. And you might ask why, and it is because somebody goes at it hammer and tongs, eats nothing, gets starving, comes in at 6 o'clock and says, I'm starving, eats everything in the fridge, and the diet's over. So, like, it's very important to set yourself small goals, and it's the same in everything in life. So you need to set yourself, like, what can I achieve here? And I suppose managing stress is a big thing as well, and that's one of the reasons people come to our centre. So when you're diagnosed with cancer, you have to put all your other concerns aside. You just get through the treatment. And like when you hear Phil's story there, that's what she's been doing. She's been getting through her treatment. But then just when she got the good news and when everything seemed okay, the black dog of depression came along and hit her. And like that's what happens. As soon as your treatment's over, as soon as you fall out of the hospital system, you start to think about these other things that you put aside because you had no time for them. And that's why the biggest reason, like we saw 1,400 people last year, and of that 2/3 were patients and 1/3 were family members, because we offer services to both patients and anybody affected by cancer. And the biggest reason people come back is that they think that the day they walk out the door and they're given the all clear in inverted commas, or they're told that if they had a good response to treatment and they're going to get, they're going to be brought back for a checkup in 3 or 6 months' time, you think this is great. But then all the doubts start to come in and all the worries start to come in. And so that's why, very often, that's when people really need support. And of course, your support's gone then, because everyone looks at you and says, God, you look great. It's fantastic, you look great today, I'm delighted you're so well. And they don't know what's going on in your head. The one thing that irritates cancer patients a lot, generally, not just ovarian cancer patients, is being told to look really well when they don't feel that well. When they have things like fatigue and stuff like that because of treatment. So that can be a really tough time. So I suppose I was putting it in here because it's such a recurring question for us, but so many cancer survivors worry that stress may have played a role in their illness, but in fact they're just random events and we don't know what the cause of them are. So we know stress isn't good for us anyway. I mean, we wouldn't like to be living a very stressful life, and it can cause other health problems, but is it linked specifically to cancer treatments or to cancer diagnosis? No, it's not so far. So, but at the same time, I think you should work at reducing your stress levels. So exercise, really, really good for stress levels. Mind-body relaxation, like relaxation and visualization. Creativity, being creative. We have an art class that happens once a week. And sometimes the art teacher says to me, God, that was a really amazing kind of 2 hours we had together. And and there's no themes, just people come in and kind of paint or draw whatever they want. And they're just gently guided by Maeve, our art teacher. And yeah, so it's been a very creative way of dealing with cancer. Or sharing your story, which exactly is what Ovacare is all about. A way of not feeling alone, breaking the isolation in cancer, which is really important. Because it's fantastic to meet someone who says, I know exactly what you're talking about, because actually I had this. And I know, I completely get it. So I'm a big believer in humour and laughing, and yesterday in our office we had one of our volunteers in, and she told us a story about a mobile phone, and we had I won't repeat it now because I'm sure it wouldn't be as funny when I tell it at third hand, but it was the first time I had a really good belly laugh in about 2 months, and I found it so helpful. And in the office, Martina was there as well. She could back up what I say. So anyway, I think laughter is really good. It really helps you relax. So actually when you laugh, your brain releases chemicals and produce pleasure and relax your muscles. So it's not just, it is actually found in research. And smiling can help stress. And I suppose sometimes what's really beneficial for us, or what's really kind of rewarding for our services, when someone comes in and says, maybe sometimes people use, on average people use our services for about 2 years when they come first. They kind of continue to come, or maybe they go away for a while and they come back again. But I suppose it's this whole thing about like what's really rewarding for us is the feeling like that I had somewhere where I belonged, where I didn't have to justify myself, come in and have a cup of coffee because we have a drop-in service and you don't have to make an appointment to come and see anyone. And just feeling like as soon as I walk in the door, like, they get me here. Like, and if you want to go in and not talk to anyone or sit down in the library and read a book or have a cup of coffee, that's fine too. Like there are no rules around it. And there are so many rules around cancer. Our place has very few rules actually. So I suppose it doesn't mean you always feel like laughing, but it's important to have people around you that make you laugh. I always think in your circle of people, sport people, there should be somebody who challenges you and somebody who makes you smile, because that's actually a good way to be. So watch a funny movie or TV show. And I have a rule in my life that I actually don't watch movies unless they give you a good laugh, because I think life's hard enough on its own. Listen to comedy recordings. You know, if you're into somebody like Oliver Kahn or Kellen's Kicks or any of those things, sometimes you can get a laugh out of that. And make sure you have people in your life who see the lighter side of life sometimes, you know, because that's important. So coping with emotions, and I suppose when your treatment finishes, your emotions don't change, or maybe they even get stronger. So if your emotions, I see in your booklet there that if your emotions are manageable, sometimes it is necessary to go and talk to somebody one-to-one. And talk to your GP or maybe the team that treated you in the hospital or your local support centre if you have one. And I suppose that's a really good thing in Ireland, that we actually has a network of support groups. We actually probably don't range too badly or rate too badly in terms of other countries. When we were in Lisbon, there were lots of people there from Korea and Malaysia and other parts of the world, Japan, where cancer support services are only just in their infancy. So we're probably not doing too bad on that level. So what would you watch out for if you're living with a cancer diagnosis, or maybe post-treatment, or maybe just in the middle of treatment? What would you say? What are the signs that you really need to go and do something about it? So anxiety beyond what is manageable. We all suffer from anxiety at some level, and that's fine, because that's normal. Normal stress is actually good for us because it makes us do things. But if your anxiety is kind of crippling, it's stopping you enjoying your life, if you're not living in the present moment, then you think about, like, what can I do about this? A sense of being overwhelmed, like not able to kind of just feeling like my emotions are too much for me. If you have guilt feelings, I put that in there on purpose because I think that a lot of cancer patients suffer needless guilt because they're very guilty for getting the cancer in the first place, even though it's not their fault. And they're guilty about the distress maybe they cause the people they love in their lives, like their kind of people, their families or their friends are upset for them, and they hate having caused that distress. So I think that if you feel like you're more guilty than you should be, and you shouldn't be guilty at all, then maybe that's something to talk to somebody about. If your mood's very like volatile, it's kind of up and down, and you have a lot of mood changes, then you need to watch out for that. If your concentration problems, and of course there's this phenomenon which oncologists don't accept, which we totally believe in, which is that this thing called the chemo brain. And it seems to me that some people really suffer at the end of treatment in terms of like, the concentration levels maybe go down. If you focus on your problems too much, you can't actually think about anything else. If you don't get any joy in life. Because remember, your cancer isn't all of you. It's only a bit of you. It shouldn't define your whole life, particularly if you're post-treatment. And maybe a lot of our clients would avoid situations that they found enjoyable. So they're not meeting people socially. They're not maybe going out for a drink, or maybe they don't go to a wedding that they invite to, or they don't meet people for coffee or stuff like that. And just things, really avoiding situations that they found enjoyable previously. So what's the fifth rule? So the fifth rule is don't struggle on your own. You shouldn't be carrying this burden alone. Don't be afraid to express your feelings, even if they're very negative. I'm sure you all remember growing up that, or at least this happened to me, maybe I had a very difficult childhood, I don't know, but we were kids at home, say if something happened, like say we got into trouble or something, and we start crying, and maybe one of our parents would say, like, if you don't stop crying, something worse will happen to you. And like I think for that reason alone, like we think that kind of crying is bad for us. So I think it's really, really important, because once you express a strong feeling, it kind of dissipates, it goes away. It's holding it in that takes all our energy. It's not saying it. So having someone to say it to that you can kind of trust is really important. Have one or two good friends you can rely on. You don't need 100 people to support you. You just need one or two reliable people that you know aren't going to judge you, but are going to gently challenge you, which is really what you want someone to do. And asking for help is a sign of strength, not weakness. It's not weak to ask for help. And I suppose we have a lot of men who come to our service, and either family members or men with cancer themselves. And I suppose for them it's a real adjustment, like having to ask for help or having to need help. And they often struggle with the idea that that might be a weakness. So Phil mentioned this already, and I'm just going to reiterate what she said, that I think feeling lonely and feeling isolated is very common in cancer, completely normal. And I suppose a lot of people, this causes them anxiety, that like feeling like there is nobody who really gets me the way I am. I've been afraid to say how you really are, like not able to say it. So again, that's a really, really common theme that emerges for our clients. And so rule 6 is try and find a new source of support. Maybe your best support isn't from the people you normally expect it from. Maybe it's from a completely different area. Maybe it's from Ovacare. Maybe it's from Cancer Care West. Maybe it's from your friend you haven't seen for 10 years. A good friend, a local support centre, or a local support group, or a group on the internet. And I suppose that support comes from unexpected sources, and I totally have had experience with that lots of times, and I really believe it. I suppose the other thing in cancer is that it comes up as kind of the spiritual side of it, and a lot of people really find they have a need to understand their cancer. And I suppose this is kind of a theme in psychology, is a thing called narrative therapy and meaning making. And what that says really is that when we have very big events in our lives that really challenge us, we have to find some way of understanding them, of making sense of them. So if you have somebody diagnosed with lung cancer who smoked all their lives, it's not hard to actually, for that person to say, well, I got this cancer because I smoked, and I probably should have stopped 40 years ago, and I didn't, I kept doing it. And so in some ways that might be easy to make sense of. What happens if you get ovarian cancer and there's really no reason for it? There's no, like I see a list there of kind of risk factors, but suppose you don't have any of those risk factors, or you only have one of them. How do you make sense of this huge event? So I suppose what that leads people to doing is really redefining their lives, and maybe redefining their values and their priorities and what it means to be alive. So I think that's really, really, that's the silver lining on the cloud of cancer, that if you get a chance to do that, if you actually start to think about, yeah, what's really important is these one or two things. So kind of a new focus. And sometimes when people aren't able to do that, when they aren't able to find some meaning in the cancer, they struggle more, I think. So it's important to be able to find meaning so you can put it aside in some way and just take it out and look at it when you need to, but it doesn't define all of you. So I suppose rule 7 is take time to get to know the new you. Who are you now that you've had a cancer diagnosis? How are you different? Are there things that are more important to you? Are there things that are less important to you? Remember, your cancer isn't all of you, which I think is really, really important, because in the beginning, maybe the first year or two after a diagnosis, or maybe you have a recurrence, the cancer does become all of you. It's kind of all-encompassing. It takes over everything. And so acknowledge it. Know it's there in the corner. Maybe take it out and look at it every now and then. But don't let it define you, because you're not just your cancer. And I think that's a really important kind of message. So what helps people with cancer? And these are some things that we've found over the years helps our clients. So follow your gut instinct, and no matter what profession you meet, psychologist, gynecologist, oncologist, whatever is the end of the word, it doesn't really matter, because actually there's only one expert on your body, and that's yourself. So follow your gut instinct and be true to yourself. Have really good social support from one or two key people who don't judge you. That's really, really important, because if you do that, then that's enough. You don't need 50 people to support you. Be aware of how much you can do. So this great Irish saying, cut your cloth, suit your measure, I think is really important in cancer care. And just grade yourself, you give yourself permission to take it easy. Don't overdo it. Because the problem about overdoing it is that if you overdo it and you feel really good on day one, the fact of overdoing it actually causes you to have less energy for the next week. So that's the kind of downside of that. Grade your steps to recovery. So like, just take it easy. And actually, this is great today because I don't have to mince my words, because normally we have a mixed group of men and women in our group who have cancer, but because it's all ovarian cancer today, I could say this. Women are particularly bad at saying no, and sometimes they say yes when they really want to say no. And I think it's really important skill to learn anyway, is the ability to say no and not feel guilty. If you say no and you feel guilty, it kind of takes the good out of it. So like you learn to say no and say, yeah, it was okay for me to say no. I don't want to meet this person for lunch, or I don't want to go to that function, or I don't want to, whatever it is. That's really important. Learn to manage your stress levels, whatever they're at, and take time for yourself. That's not being selfish. And I think women, and Irish people in particular, are very prone to kind of feeling selfish about things that shouldn't be selfish, or feeling guilty about stuff that shouldn't be guilty about at all. So taking time for yourself is not a bad idea. Maybe that means just going for a walk, or listening to music, or meeting a friend. That's what taking time for yourself means. Believe in yourself and your ability to cope, because that's really important. We're all very resilient. Retain hope, so that you will be hopeful about yourself and your future. And learning relaxation and visualization skills are really important. And say they cost nothing. It's very easy to learn it, and it's a very good way of coping. So going to the end of my talk, and I just want to talk about resilience for a minute, because just to say, we are much more resilient than we think we are. What is resilience? Resilience really is our ability to stay going, our ability to kind of get through things. And if I had €1 for every time someone says to me, if someone told me I'd get this cancer and I'd survive it and I'd be okay today, I wouldn't have believed them. I think that is one of the big lessons in cancer that people learn. I'm much better at this. I wish I hadn't to do it. Doesn't mean it's okay that I had to do it, but I'm actually much better at it than I thought I was. And I suppose that serious illness challenged us to redefine our priorities, our values and our belief systems. So again, that can be like a time out for ourselves. And I suppose the idea this is diagnosis cancer, but what it means up to you. And I just think want to say towards the end, nothing lasts forever. Everything changes. And every day, you know, when you think about what you worried about a year ago or 10 years ago, is that really important today? Probably not. We hardly ever live in the present moment. We're usually living in the past that we can't change now, or the future that hasn't happened yet. What we all have is today. Whether you have a cancer diagnosis or not doesn't really matter, because actually we all are living today, and that's where we should put most of our energy. So what do I want to do today for myself? What do I want to do in terms of coping? And that's really, really important, because actually we have control over today. So if you got up this morning and decided to come in here to this kind of day out for yourself in terms of learning more about ovarian cancer and how you can manage it. And that's a decision that's really healthy, but that's what we need to make decisions about. I don't mean you don't plan for the future, I'm not saying that for a second, but I just think our energies should be in today and not in the future that we haven't got yet, or the past that's already gone and we can't change. So I want to finish there.